Assalamu alaikum doctors, myself Mohammad Asim Hussain, working as product manager in Genix Pharmaceutical. Dear doctors, welcome in webinar session on behalf of Genix Pharmaceutical Management. Genix Pharma was founded in the year 2004. We have vision to help and provide top quality and affordable medicine for all those in need. Genix is being one of the fastest growing company in Pakistan pharmaceutical arena. We remain committed to improve the life of people associated with us at all levels because we are dedicated to good health. Today, our session is a part of educational activity and presentation topic is very unique. That is anxiolytic and neuropathic pain management guidelines and consideration and expert opinion in neurological perspective presented by a well-known senior consultant neurologist, Dr. Asad Ullah Khan. Dr. Asad Ullah Khan is assistant professor in Lady Reading Hospital, Peshawar, Department of Neurology. He is professionally very busy person, but always available for education. Thank you so much, sir, to join us and give your precious time. Dear doctor, if there is any question or query, please drop your question in chat box. Question answer session will be after presentation. Over to you, sir.
Jazakallah. Thank you for such a nice introduction. My name is, as introduced by Sir Asad Ullah Khan. Today's topic is about well-known medication that's you may have every one of you may have written in any form. That's Pregabalin. You may not be a doctor if you may have written Pregabalin. It is used in many forms. It is having many actions. Today's topics, it is mainly used as in pain management, especially in neuropathic pain management, and also it has role in anxiolytic as an anxiolytic. And today's main preference will be on its guidelines and its considerations. Introduce you to Pregabalin. It's a medication. It's a very old medication. It's really commonly used medication, very commonly used, especially in neuropathic pain. Let me tell you, especially there is a very important difference between normally in normal pain, especially if a patient is having a pain of surgical wound and pain of neuropathic pain. These two pains are totally different. So a neuropathic pain, if patient is having neuropathic pain, it's not going to be suppressed by simple NSAID. So you have to have a sense of differentiating between common pain and neuropathic pain, because otherwise simple NSAID is not gonna heal it. And definitely this Pregabalin belongs to the class of usually doctors don't know which class Pregabalin belongs to, and you will be amazed to know that it is a anticonvulsant, and it is genuinely a anticonvulsant, anti-epileptic medication. But we usually use less. Pregabalin is used less as a anti-epileptic and more as a neuropathic pain management in neuropathic pain management. So Pregabalin on its pain management in work, how does it works? So it works in many ways. In epilepsy, it stops seizures by reducing the abnormal electrical activity. In nerve pain, neuropathic pain, it blocks the pain by affecting the pain messenger traveling through the brain and down the spine. In anxiety, it stops the brain from releasing the chemicals that are involved in the anxiety. And in context of neuropathic pain, especially the Pregabalin is approved for various conditions, especially the hallmark, that is the diabetic neuropathy, in which mainly it is used, and post-arthritic neuralgia, that is really painful condition. um, that is following the shingles and fibromyalgia. It is believed to work by reducing the hyperexcitability of nerves and dampening the abnormal pain signaling. So pregabalin got approval from US FDA in 2004. It is used as to treat neuropathic pain and seizures. FDA approved its indications mainly as a first line. I'm telling you, as a first line in neuropathic pain. In neuropathic pain, especially in diabetic peripheral neuropathy, in many spinal cord problems like spinal cord injuries like transverse myelitis, traumatic spine injuries, in post-herpetic neuralgia, trigeminal neuralgia, fibromyalgia, and it can be given as adjunctive treatment of partial onset seizures. But pregabalin is also used in off-label uses, can be given as generalized anxiety disorders, social anxiety disorders, chronic pain conditions, chronic pruritus. It can be used. Uh, it can also be given in chronic cough. Definitely in restless leg syndrome, it can be given as it's very effective. So, well, the most important after the role of pregabalin after neuropathic pain is anxiolytic role of pregabalin is the mechanism of action. Definitely, it exerts anxiolytic effect through its binding of alpha 2 delta subunit. That's mainly the voltage gated calcium channels. Definitely, it's a complicated type of mechanism. You should only remember that it's through voltage gated calcium channels. And the two main indications that are important are generalized anxiety disorder and social anxiety disorder. The efficacy and clinical studies. The present key clinical studies demonstrating the efficacy of pregabalin in treatment of anxiety disorders. In generalized anxiety disorder and social anxiety disorder, always and always start from lowest dose from 75. Definitely it takes time. You have to go to increased doses. You have to monitor. The most important thing is the side effects, especially in ladies. You have to monitor the side effects. The most important side effects are dizziness. आपने बहुत important चीज जो है side effects में dizziness, चक्कर चक्कर आते हैं. The second most important, sedation. नींद ज्यादा आती है, so you should prefer that in evening or night. Fatigue, confusion, old age, you should be very careful. Old age लोगों को आपको ख्याल से देना चाहिए जो कि जिनमें डिमेंशिया हो, ओल्ड एज हो. The patients में ख्याल से, already patients having peripheral edema means पाँव में अगर सूजन हो, you have to be very careful because ये already swelling को ज्यादा करती है. Ladies who are weight conscious, you have to be very careful because ये already weight gain करती है. Gastrointestinal side effects, almost every medication कुछ ना कुछ देती है, so कुछ ना कुछ तो pregabalin के भी हैं. So blood vision and ये चीजें भी थोड़ी सी इसके साथ होती हैं. So main जो side effects हैं, the most important are dizziness, sedation, peripheral edema, weight gain. These are the most important side effects you should be considering. Well, in earlier slides, when I told that it can be used as an anxiolytic. So in anxiolytic, the kings really are the benzodiazepines. So definitely we have to compare pregabalin with the benzodiazepine in generalized anxiety and social anxiety disorder. When we compare pregabalin with benzodiazepine, so definitely they are not superior, even they are not comparable with the benzodiazepine because their onset of action is not as rapid as benzodiazepine. and their efficacy is not as comparable to benzodiazepine. So definitely they are not as first line. Definitely they can be add on to benzodiazepine or add on to other medication in social anxiety or a generalized anxiety disorder. Definitely pregabalin, the main action or main use, that is in neuropathic pain, which is in most important is the diabetic peripheral neuropathy, trigeminal neuralgia, post-herpetic neuralgia. That is the main indication in which pregabalin is used. Well, most of the time that I am seeing, मैं जब देखता हूँ कि GPs इस बात पे खफा ना हो, जब मैं देखता हूँ इवन काफी बड़े कंसल्टेंट से भी ये गलती मैं देखता आ रहा हूँ, हर डायबिटिक को प्रीगैबलिन की जरूरत नहीं होती। वो इस वजह से कि अगर कोई पेशेंट आपके पास आया है और वो कहता है कि मेरे पाँव हाथ सुन्न हो रहे हैं, that patient doesn't need pregabalin. The pregabalin is needed for that patient जो कह रहा है कि मेरे पाँव और हाथ जलते हैं. That's the most important thing. तो सुन्न जो हो रहा है उसको तो वैसे ही pregabalin की जरूरत नहीं है, because this is not neuropathic pain. So pregabalin is indicated for neuropathic pain, not the numbness. That's the most important thing. The GP should consider this. So because these trigeminal neuralgia, shingles, and diabetic peripheral neuropathy, it's all about burning sensation. That's the neuropathic pain, and the NSAIDs doesn't cover this. So for that, pregabalin is the ideal medication. And this pain, which is allodynia, in which even normal touch, even touch, आपको जो normal touch भी है वो भी आपको pain सा महसूस होता है. This is called allodynia. So in this kind of pain, pregabalin is very effective. So that's the most important thing, that in numbness, pregabalin doesn't affect. In neuropathic pain like burning sensation, pregabalin works. So neuropathic pain may be often suspected or identified through some of the classical descriptions of the pain that can be such as burning. अब यहाँ पे मैं आपको मैंने एक बड़ी important point बताया, that GPs in the periphery, most importantly आपको ये जो चंद अल्फाज आपको नजर आ रहे होंगे, burning, shooting, tingling, electric like, shock, sharp, nagging, walking, hot, cold, इसमें कहीं भी नहीं है कि numbness या मेगी ये चीज नहीं है. तो जब ये बर्निंग, शूटिंग, टिंगलिंग, इलेक्ट्रिक लाइक होगा तो तब प्रीगैबलिन या साइपिल आप लिखेंगे, अदरवाइज नहीं. सो और इम्पोर्टेंट चीज इसमें मैकेनिज्म का है. सिंपल पेन इज बीइंग मीडिएटेड बाय सब्सटेंस पी. दिस पेन इज न्यूरोपैथिक पेन. ये नर्व के डैमेज की वजह से होता है. The pain is often worse at night and paroxysmal. मतलब रात को भी ज्यादा है, paroxysmal बार होता है या जारी रह सकता है. Characteristic signs and symptoms are hyperalgesia and increased sensitivity to normal pain stimulus. आपको हल्का सा पेन भी ज्यादा महसूस होगा. आम टच भी आपको पेन महसूस हो सकता है. कोई आपको चादर ऊपर पांव पे डाले, आपको वो भी पेन महसूस होगा. So that's the important thing. जैसे लिखा हुआ application of cotton swab, wearing of clothes. So this also feels like pain. Patient beliefs and perceptions of pain, and it causes coping strategies, mood changes, disturbed sleep, anxiety, all need to be addressed. Therefore, treating anxiety or depression first might be also reduce the need of analgesics. In neuropathic pain management, pregabalin exerts its analgesic effect in neuropathic pain through modulation of calcium channel activity. Indication approved in indication of pregabalin in neuropathic pain conditions such as diabetic neuropathy, that are already mentioned, the most important indication. Diabetic peripheral neuropathy in initial stages is जो initial stages होते हैं वो burning phase होता है. जिसमें अभी axonal loss नहीं हुआ होता, so you can give the pregabalin. But in later stages, when the axon is lost, there is numbness, so there is no need of pregabalin. So post-herpetic neuralgia, if someone is Pashtun, he can understand lamba. So post-herpetic neuralgia lamba, after that you can give pregabalin. So fibromyalgia, that's a vague thing. इसमें भी pregabalin दी जा सकती है. Off label use pregabalin का बहुत सी diseases में है. It can be used in multiple peripheral neuropathies, spinal cord traumatic injuries, trigeminal neuralgia, restless leg syndrome. The most important thing, many clinical studies and guidelines like American Diabetes Association, European Federation of Neurological Societies, and NICE demonstrating the efficacy of pregabalin in treatment of neuropathic pain. That's the most important. दुनिया की बड़ी-बड़ी जो guidelines हैं, वो pregabalin को authenticate करती हैं कि that's efficacious है in neuropathic pain management. The most important thing, clinically proved that pregabalin may be used as pain intensity reduction, improve sleep and functional outcomes. Dosing and titration, that's the most important thing. It can be given as 3 times a day. इसकी important point ये है कि इसकी जो half life है वो 6 to 7 or 8 hours है. The most important pharmacokinetics जो इसकी हैं, ये renally excrete होती है. The most important thing, you have to be very, very careful in renally compromised patients. Because most of the time, मैंने ज़्यादा emphasize किया diabetic peripheral neuropathy पे. Diabetic patients renally compromised होते हैं. Usually उनके RFTs अभी इतने deranged हुए नहीं होते, but they are renally compromised. उनका GFR down होता है. तो अक्सर ऐसा होता है, आप डायबिटिक्स को 75 मिलीग्राम देते हैं और दूसरे दिन या हफ्ते बाद आता है कि डॉक्टर साहब मैं तो 2-3 दिन सोया रहा, ये कैसी दवाई आपने दी है. So you have to be very careful. Start with low dose. So your initial dose should be very low, especially in diabetics. Okay. So initial dose should be 50 milligram. Okay. Especially in diabetics. Otherwise, with lower back pain, go with high 75, 100 you can give. But in ladies and diabetics, you should go with a low dose, okay? And start from low dose. You can give it 3 times a day. But if a patient is driver or heavy machinery handler, so avoid in morning. उनको आप बताएं कि इसमें sedation है, so he should be careful, okay? And the most important thing in neurology is अक्सर लोग पूछते हैं side effects. So the side effects are या maximum dose क्या है या side effects क्या हैं जी, जितने तक आप tolerate कर सकते हैं, नहीं आ रहे तब तक आप ले सकते हैं उतनी मिलीग्राम या उतने तक. That's the most important thing. So definitely we shouldn't leave behind the aspect of pregabalin where it belongs. That's the class where it belongs. It's an anticonvulsant, definitely. So definitely we should discuss the anticonvulsant doses initially. If it is never used as a first line anticonvulsant in any form of epilepsy, but it is used as an adjunctive cases, definitely in resistant cases and difficult cases. In initially it is started from 150 milligram orally per day in 2 to 3 divided doses. Doses may be increased on weekly based or on clinical response, and maintenance can be upon 150 to 600 milligram divided doses. Maximum dose can be reached up to 600 milligram per day. Pregabalin guidelines in diabetes. So the most important American Diabetes Association standards of medical care in, sorry for a busy slide, but the American Diabetes Association standards of medical care in diabetes provides recommendation for the management of diabetes related complications, including neuropathy. While the guidelines do not specifically mention pregabalin, they recommend considering medications such as pregabalin, gabapentin, and duloxetine for the treatment of painful diabetic neuropathy. अब देखें इसमें बहुत important point है, pregabalin हो, gabapentin हो, duloxetine. इसमें important depression है, so you can choose duloxetine. So that's the important thing. If patient agar depressive problem nahi hai, you can give pregabalin. So that's the important thing. European Federation of Neurological Societies published guidelines for the pharmacological treatment of neuropathic pain, which include the recommendation of diabetes first line treatment. However, it is important to note that these guidelines are not specific to diabetes and cover the broader range of neuropathic pain conditions. अब इसमें यूरोपियन फेडरेशन इंपॉर्टेंट पॉइंट ये है कि इन्होंने जस्ट डायबिटिक न्यूरोपैथी को टारगेट नहीं किया, and they have covered a large variety of neuropathy. So any kind of neuropathy you can give pregabalin. So here I come to the end of my presentation, and I really I'm thankful to Genix Pharma for giving me the platform and for their wonderful product Cypil and pregabalin. Now the platform is definitely open for the questions. I'm really I would be happy to answer it.
Sir, thank you so much, sir, for your wonderful presentation. And I hope all participants is enjoyed also. And sir, you brief a lot and you shared also your clinical experience. And now if there is any question, please drop your question in chat box. Sir, there is no question. Please, thank you so much, sir, for your wonderful time, sir. You are also a busy person and a lot of patients are waiting for you. And sir, we have a question. What should be the treatment duration of pregabalin?
Definitely, Dr. Shaista, it depends on the symptoms of the patient. There is no hard and fast time of the treatment duration. It all depends on the symptoms. जब तक patient को symptom है, they can take it. ये कोई मलेरिया के treatment नहीं है कि they can take for 5 days or antibiotic का course नहीं है. They can take for as long as they have the symptoms. No problem in that.
For diabetic neuropathy especially
देखें, that's the symptomatic treatment. That's not the curative thing. That's the symptomatic treatment. देखें, पेन किलर अब ये बिल्कुल वैसे ही है जैसे कि आप माइग्रेन या किसी और चीज का पेन किलर देते हैं, ठीक है? तो जब तक पेन रहता है आप ऑन एंड ऑफ लेते रहते हैं. So pregabalin is just like a painkiller. So it's not the treatment of neuropathy. आप न्यूरोपैथी का पेन कम करने के लिए pregabalin दे रहे हैं. So it's just like that. So it's just a symptomatic treatment for cure of मतलब आपने न्यूरोपैथी का ट्रीटमेंट करना है. You have to control the diabetes. You have to give the methacobalamine. आपने बाकी चीजें जो न्यूरोपैथी को ट्रीट करना है वो एक डिफरेंट चीज है. Pregabalin is a symptomatic thing. वो आप जारी रख सकते हैं. That's no problem in that.
Sir, is there any dose titration in mild epilepsy?
What should be treatment duration for diabetic neuropathy? The dose of pregabalin, especially देखें जी, mild epilepsy में तो pregabalin indicated ही नहीं है पहली बात. क्योंकि हम माइल्ड एपिलेप्सी में तो जो किंग मेडिकेशंस हैं जैसे कि वेल्प्रेट है, कार्बामेज़ेपिन है, लेविट्रिसेटैम है, हम वो यूज करते हैं. ये तो मैंने आपको कहा कि हम उन केसेस में करते हैं जो कि रेजिस्टेंट केसेस होते हैं, जो कि जिनमें हमने बड़ी मेडिकेशंस को ट्राई कर चुके होते हैं और वो ट्रीट नहीं हो रहे होते. तो उनमें हम एज ए एडजंक्टिव ट्रीटमेंट यूज करते हैं.
So next question is for post-traumatic neuralgia, one of the my patient is taking for last 1 year.
They can take G for as much as their for their life. For as much as their life, जब तक उनको पेन है, no problem in that. ये पेन दुनिया के worst पेन में से एक है जी.
Sir, our team member also is here and he is sharing his experience. Sir, my mother is cardiac patient and diabetic patient and doctors prescribe pregabalin for body pain. So is it
जी
safe?
मुझे जरा सा देखिए ना, इसमें अब बहुत इंपॉर्टेंट पॉइंट है कि पेन जो है उनको रात को या दिन में किसी भी वक्त पाँव में जलन होती है कि नहीं. पाँव में जलन होती है तो शी नीड्स प्रीगैबलिन. ये जिस्म के दर्दों के लिए नहीं है जी.
So what is your experience in stroke neuropathic pain?
हाँ बिल्कुल जी. देखिए स्ट्रोक मुख्तलिफ किस्म के होते हैं. अगर थैलेमिक स्ट्रोक है तो उसमें प्रीगैबलिन आइडियल वर्क करती है. Can we treat pregabalin when someone is in depression? Why you want to give pregabalin in depression? Actually, for depression, you need to give the SSRIs, SNRIs. If there is element of anxiety, definitely you can give. If you want to give some sedation, definitely you can give this thing at night.
So is there any interaction between pregabalin and other medications?
Pregabalin को इतनी खास interactions नहीं है.
Thank you so much, sir, for your nice presentation, and I really enjoyed question answer session as well. Thank you so much, sir.
Jazakallah, Jazakallah. I really enjoyed the questions, definitely.
Thank you so much, sir. Thank you.